Hi, welcome everyone to our Cecilia Health webinar. Tonight we are doing healthy eating with CKD. I'm Emily, I'm one of the dietitians. And here at the bottom of the webpage, you will see a phone number, 1-800-263-6317. That is, if you're having any IT difficulties, please reach out to that number. And thanks again for joining us. And we see here, oh, let me bring up the slide. I think it's stuck. You'll see here for tonight, it is an interactive program. The format of our program includes a short presentation by Nancy, one of our other dietitians. And at the very end, you will have a chance to ask any questions that you have. We do know that with diet, with nutrition, there's always questions that people have. So please use your toolbar off to the right-hand side of your screen and to ask your question so Nancy can answer it here at the end of our program tonight. And just as a disclaimer as well, next slide here. Please. Oh, there we go. Just as a disclaimer, we know that the information you are about to hear may motivate you to make some lifestyle changes, but please do talk to your doctor before making any changes to your current routine. The Cecilia Health Registered Dietitian will provide strategies to help you manage your CKD, but this online Q&A session is intended to give general advice. It's not meant to substitute for personal medical advice and involves the professional opinion of the Cecilia Health clinician. And the main resource for the presentation tonight was the American Kidney Fund as well. So our presenter tonight, I'm happy to announce, is Nancy Cohen. And just a little bit about Nancy. She is a licensed registered dietitian. She currently lives in Pennsylvania, and she has her degree in nutrition and dietetics from the University of Florida and has been working in the nutrition field for over 40 years. She educates clients in all areas of medical nutrition and wellness and is happy to be a member of the Cecilia Health team. She is a mom of an adult 30-year-old son and has a passion for her beautiful Weimaraner dog, Dinah, and Nancy might have to correct me on that one, but she loves to work with all of her clients online in the Cecilia Health CKD and also the weight management programs as well. So she brings a positive attitude to all on ways to incorporate good nutrition into life and make the most out of every day. So thank you again, Nancy, and I'll hand it on over.
Thank you. Thank you very much. Hi, everybody. Welcome to the webinar. Tonight's webinar is on CKD, and if you're listening, I'm so glad that you're here. So on our agenda tonight, we're going to cover these areas. We're going to talk about how food impacts CKD, which stands for chronic kidney disease. We're going to talk about the important nutrients for all CKD stages: sodium, protein, and fluids. We're going to discuss additional nutrients to monitor in stages 3 and 4, and we're going to put it all together with a summary of stages 1, 2, 3, 4, and 5, and maybe some ideas about recipes and supplements. And then time for questions and answers. So let's get started. It's a full evening, and thank you everybody for being here. So food is very important in everything, but it's very important in chronic kidney disease because everyone can benefit from making healthy food choices. But it is even more important for those with CKD because good nutrition helps provide energy for daily tasks, prevent infection, and avoid loss of muscle mass, as well as help maintain a healthy weight and additionally slow down the progression of kidney disease. There are several nutrients that affect the kidney. We talk about micro and macronutrients, which is basically a term for either vitamins and minerals and smaller elements, and macronutrients are like bigger food particles like carbohydrates, proteins, and fats. So while there are several of these that are very important when designing a kidney-friendly eating plan, Your stage of chronic kidney disease is what determines which ones we really need to focus on. So we will first look at the nutrients that are important to consider in people with all of the stages of CKD 1 to 5. Then we will discuss added nutrients we need to monitor in more progressed stages of CKD, stages 3 to 5, but not yet on dialysis. So important nutrients for all stages. We'll discuss sodium, protein, and fluid. So sodium is a hot topic. Sodium is a mineral found naturally in foods, and it's a large part of table salt. And when your kidneys are not healthy, extra fluid and sodium can build up in your body. This can cause an increase in blood pressure, shortness of breath, swollen ankles, puffiness, fluid around your heart and lungs. So very important. How much sodium is part of a healthy diet? So most Americans have too much sodium in their diet, and a general healthy diet should contain no more than 2,300 milligrams of sodium a day. This is equal to 1 teaspoon of salt per day. So you may be recommended to consume less sodium with kidney disease, such as a goal of 1,500 milligrams of sodium a day. And you can ask your dietitian coach about that or your doctor. But why should we limit our sodium intake? Some amount of sodium is needed for body water balance. But when your kidneys lose the ability to control that balance, this can cause thirst, fluid gain, and high blood pressure. Consuming less sodium can help control these problems. So it is important for you to start thinking about this. These are the foods that have added salt. Bet you didn't know this. Soda and sports drinks, ice cream, frozen dinners and snacks, fast foods, restaurant foods, packaged snacks, bakery items, condiments, like ketchup and salad dressing and things that you add for flavor, canned and jarred foods, seasoning and spices with salt, and cheese and processed meats like ham, sausage, salami, bologna, some of the deli meats, and hot dogs. So it is very important for you to continue to read your nutrition labels. So here are some helpful tips from the National Kidney Foundation. Understand that when you see these terms on a label, sodium-free means only a trivial amount of sodium in a serving. Very low sodium means 35 milligrams or less. Low sodium is 140 milligrams or less. The term reduced sodium means that they reduced it by 25%, but we'll still want to come back to reading it that. And light sodium means it's reduced by 50%. So the simple rule of thumb is, if salt is listed in the first 5 ingredients, the item is probably too high in sodium. So let's take a peek at this label. All food nutrition facts labels have milligrams or mg of sodium listed. So the following steps will help us read labels. Know how much sodium you are allowed each day. That's the number 1. And remember that there are 1,000 milligrams in 1 gram of sodium. So 1,000 milligrams equals 1 gram. And for example, if your diet prescription is 2.3 grams of sodium, then that means it's 2,300 milligrams of sodium a day. And consider the sodium value of other foods you plan to eat during the day. And I'm just going to throw in my pet peeve. Don't read the percentage. See how this says sodium 270 milligrams, 12%? Just read the milligrams. That's the information you're looking for. The percentage kind of confuses us, so stick with the number on the left. Okay, let's continue. So look at the package label. Check the serving size, which is also so important. We'll tell you how much soda. So if you eat 50 crackers, you're not eating 270 milligrams of sodium, you're eating double that. So make sure that you understand that the serving size is what the sodium is for, and then it increases the more servings you eat. So compare the item to the grams of sodium and then the size of the serving, and that's very important. And of course, it's really helpful to select the lowest sodium level for the same serving size. So read your labels, which I know you're all experts, so good job. So here are some really great tips for reducing sodium in your diet. Choose no salt added canned foods. So you can look in the store, a lot of vegetable products are canned in salt, but a no salt added means they didn't add any sodium. Also, just be aware that if you don't need to watch your potassium intake, we'll talk about that in a few minutes. So choose no salt added canned foods. Add Mrs. Dash or other no salt seasonings instead of salt while cooking at the table. Use these other flavoring agents like lemon juice, herbs, and spices for flavor while cooking. Cook more foods at home. Use kidney-friendly recipes to control the amount of salt in food. Avoid fried foods because the breading has salt, and many times fried foods are salted right out of the fryer. Drink water instead of soda and sports drinks because soda and sports drinks have salt or sodium in them. Look for snacks that say no salt added, as we talked about before. And then when you're eating out, choose foods that are steamed and grilled instead of fried and blackened. And also while eating out, ask the server to ask the chef to not add salt to the dish. And choose from the diet menu at Chinese restaurants. And one thing that is important to note that you want to avoid salt substitutes that say new salt or no salt because they are made with potassium, and you need to make sure that you're not adding extra potassium, and you would want to go over that with your doctor. So these are some really great substitutes for salt and salt seasonings, because all of these foods in the middle column are full of sodium or table salt. So table salt, seasoning salt, garlic salt, onion salt, you can read them with me. Celery salt, lemon pepper is full of salt, which is interesting. Meat tenderizer like MSG and Accent and some of the Spanish sazon, they're really high in sodium. So look for other substitutions or lower sodium products and read your labels. Other salty foods that are high in sodium include like barbecue, soy sauce, teriyaki sauce, oyster sauce. I'm getting really thirsty just saying them all. Salted snacks. So really be careful with foods that have a lot of salt in them, and then perhaps look at making your own sauces and making your own snacks or getting the unsalted version of them. And then something that we don't think is full of sodium is cured foods, because what it was originally was these foods would be salted so they would have a longer shelf life, but they're really not great for your kidneys. So things like ham, salt pork bacon, sauerkraut, pickles, pickle relish, lox, herring, and olives. Those are cured foods, and you want to work with more fresh foods like beef, veal, pork, poultry, fish, and eggs that are not seasoned and pickled or cured. Two other categories that are high in sodium are traditional like deli meats and luncheon meats, cold cuts, and the lot that are up there. So read your labels and look for low salt versions of these foods. And then processed foods, things that are, they either have additives, like buttermilk is milk that has been processed, but it has salt in it. So that's high in sodium. Cheeses can be very high in sodium, canned products, and frozen and convenience foods. So read your labels and perhaps either get a lower reduced sodium version of it or make it yourself from scratch. So these are some really great tips and important things to note as you're working on lowering your sodium intake. Okay, so moving forward, protein is the next item that we're going to be chatting about. Protein is important for us. It's made up of amino acids, and we need it to for our body to function properly. Protein is used to build muscle, heal, fight infection, and stay healthy. And we all need protein in our daily diet, and the amounts vary by our age, our sex, and our overall health status. And it can come from animal products as well as plant products. So if you have kidney disease, however, your body may not be able to remove all the waste from the protein in your diet. So too much protein waste can build up in the blood, causing nausea, taste changes, weakness, and loss of appetite. The more protein waste that needs to be removed, the harder your kidneys need to work to remove it. So this can cause your kidneys to wear out more quickly. Many studies show that including plant-based foods can help slow the loss of kidney function. Here are some ideas for animal and plant proteins from the National Institute of Diabetes and Digestive and Kidney Diseases. So animal-derived proteins include chicken, fish, meat, eggs, and dairy. And the recommended serving sizes, this is the portion size, is 2 to 3 ounces, or about the size of a deck of cards. Or if you're looking at dairy, it's about a half a cup of milk or yogurt or 1 slice of cheese. If you're looking at plant-based proteins, then you're looking at beans, nuts, and grains. And a single serving of beans is about a half a cup. A portion of nuts is a quarter cup. And a portion of bread is a single slice. And a portion of rice or noodles is about a half a cup. So here are some lean proteins that are suggested, such as whole eggs, quinoa, egg whites, fish, pork tenderloin, skinless chicken, skinless turkey, soy products, and lean beef, such as tenderloin or ground. So not like the rib meat, but the leaner cuts of meat. Any place you see the word loin is a leaner cut. So how do we figure out how much protein we need? This is an interesting one, everybody. So the daily recommended amounts are, for the average male, about 8 ounces of lean protein a day, or about 56 grams. And for the average female, 6 to 7 ounces, or about 46 grams of protein. That's if you have stages 1 and 2 chronic kidney disease. And again, you can sort that out with your nutrition coach or your doctor. If you have stages 3, 4, or 5, then we recommend decreasing the protein a little bit. And and the dietitian can help you calculate this. With stage 3, 4, or 5, we recommend 0.25 to 0.27 grams of protein per pound. So let's say you're a 132-pound female, then we recommend 33 grams of protein up to 36 grams of protein per day. So it's about 10 less than the stages 1 and 2. If it was stage 5, hold on, let me just go back there. Yep. Okay. And if it's stage 5, once you start so stage 5 is the dialysis stage, and most of our clients here at Cecilia Health who are on dialysis have been given diets by their dietitians and doctors. So we're not going to focus too much on that today, but once you start dialysis, your protein needs increase or decrease. Please speak to your registered dietitian there and doctor or nurse and allow them to tell you how much protein you should be eating at that stage. Okay, thank you. So we're going to move forward. So we did sodium because we have a lot to cover, really interesting stuff. So let's move on to our next macronutrient, which is fluid. So fluid is what you drink, and when you have kidney disease in stages 1 and 2, it is so important to drink enough water, around 64 ounces or 8 glasses of water every day. This will help keep your kidneys hydrated and working well. Once you reach later stages of kidney disease, such as stages 3, 4, and 5, but not on dialysis, your doctor will tell you if you have a fluid restriction. Do not assume you have one unless your doctor says that. So don't start restricting your fluid, but be aware that they might have a guideline for you. So during these stages of kidney disease, you may experience fluid retention. And if you do notice this, please reach out to your doctor because the signs include swelling in your feet and ankles, difficulty breathing or shortness of breath when walking short distances, difficulty breathing or shortness of breath while walking up a flight of stairs, or difficulty breathing or shortness of breath when lying flat on your back. So make sure that you communicate with your doctor. Let them know if you notice any of these signs of swelling or difficulty breathing, laying down, sitting up, or being active. And don't assume you have a fluid restriction unless you speak to them. Okay, good job, everybody. So now we're going to talk about some pretty interesting and important nutrients that we do discuss in the CKD world, and they are potassium and phosphorus. So there's a lot of focus on the nutrient of potassium. It's a mineral found in your body, and it helps with many functions. And people who do have kidney disease are at risk for having either higher potassium or lower potassium. So having too much or too little can cause muscle cramping problems or affects your heartbeats or muscles. And it's important to keep your potassium levels in the goal range. So to do this, you may need to watch how much potassium you are eating during the day. But please make sure you check with your doctor and say, do I have a potassium restriction or do you want me to increase it? Again, this is not something that you should take upon yourself unless your doctor tells you, but let's talk about the foods that have a lot of potassium in them. If you have high potassium, you may need to avoid certain foods. And if you have low potassium, you may need to eat more. So everybody's unique, and we know that you are too here at Cecilia Health. Almost all foods contain some potassium, but foods containing high potassium, which usually have more than 200 milligrams in them, are the ones we'll focus on with you. And one way to avoid consuming extra potassium foods is to avoid consuming the liquid in the cans, like from the fruits or the vegetables or juices from the meats. That's pretty interesting, actually. On the left are high potassium or higher potassium fruits. So you can see there's apricot, avocado, banana, cantaloupe, dates. There's a whole list. And it doesn't mean you can't have them, but certainly if you're having like 5 of them, that might be a lot. So take a look and see if these are certain fruits that you eat frequently in quantity, okay? And then fruits that are lower in potassium on the right include like an apple and blueberries and peaches and strawberries. Again, those are lower potassium fruits, and if you are asked to increase your potassium, you might switch over to the left. Check in with your doctor and your dietitian and see what information they share with you on this. These are the high potassium vegetables and then the lower potassium vegetables. So again, there's a lot to list. I'm not going to read them all out loud to you. It'll sound like I'm reciting the alphabet in Swahili, but here we go. There's a bunch. So if you are asked to restrict vegetables, take a look at not overeating potatoes or eating too many servings of broccoli. If you are looking to eat some low potassium vegetables, you can see the ones on the right. I mean, I think we've got lots of great vegetables to eat here. Onions, parsley. It's funny, look, broccoli's on both broccoli's on both sides, which is kind of funny. So take a note of that. Squash is on the right. Peppers are on the right. So take a look at the whole slide. And again, check it out with your dietitian. You can also find this information. Well, you can see the presentation again, and you can also get this information online from the National Kidney Foundation. And then here are some other foods that are high potassium and lower. So too many nuts and seeds, snuff chewing tobacco. Who knew that it was high in potassium? But we'll talk about that in a few minutes anyhow. So on the left is the potassium content of beef, bran, chicken, chocolate, granola, and on the right are the lower potassium foods, noodles, pastas, rice. Pretty interesting, actually. But again, check in with your professional to get your guidelines organized. Okay, so our next nutrient that we're going to talk about is one called phosphorus. And phosphorus is something that I guess we don't talk about a lot in the news or in nutrition, but here in the CKD program we do. It's a very important nutrient, and it has many different functions in the body, and healthy kidneys keep the right amount of phosphorus in your body. But when your kidneys are not working well, phosphorus can build up in your blood, and then that can cause damage within your body, and it can also cause calcium in your bones to be pulled out and make them weak. So if you have stages 3, 4, or 5, your doctor may ask you to limit the amount of phosphorus in your eating plan. So I know it says potassium in the slide, but they mean phosphorus. So normal blood phosphorus levels are 2.5 to 4.5 milligrams per deciliter. You can ask your doctor what is yours and ask him what he wants you to do about this. But the foods that you want to be aware of, I'm going to go to the red side with you, which is more important, are things like Bisquick, flour tortillas, organ meats, chocolate-covered nuts, so pay attention to those. A lot of dairy products, and one of the things we really feel strongly about are sodas. Dark sodas such as Coke, Pepsi, Dr. Pepper, Propel, some of those water drinks, powdered drink mixes are really high in phosphorus. They're really not good for your kidneys. Chocolate with nuts, and then a whole list of crackers and treats on the bottom. But what I can show you again is that this comes from the American Kidney Fund, and you can Google that, americankidneyfund.org, and the list is available there for you to download there. So thank you for taking a look at that. Now, did you all memorize that? I'm going to do a test. I'm kidding. It's a lot of information. We have lots of nutrients to look at, but we're very happy that you're with us tonight, and I'm going to continue forward. But you can get a lot of these individual pieces of information from the kidneyfund.org or the National Kidney Association. So good job. And if you have a question, of course, you can type that in the little chat. So back to phosphorus. We're not done here because the body absorbs 100% of added phosphorus. It's so important that you read on the labels and see what food items that it's in, because it comes in boxes, bags, and jars. And it can be difficult to find. Sometimes they don't put it on the ingredient. You know how we saw the sodium on the nutrition label? They may not label the how much phosphorus is in the food, but let's look at the bottom part of this slide. What they're saying is if it has PHOS, which is phos, and you see any word, phosphoric acid, hexa, I can't even say this 3 times fast, hexametaphosphate. Any that has the word phosphoric, phosphate, or phospho, that is a hint that it has phosphorus in it. So be a good detective and take a look at your labels as you're looking for the word phosphorus. Okay. Another place that you can find phosphorus that you want to be aware of, or note that your doctor may give you medications called phosphate binders. And these prevent your body from absorbing phosphorus from the foods you eat. If your doctor prescribes this, make sure you follow directions and take with meals and snacks as directed, because it can help control the amount of phosphorus your body absorbs. And there are several different kinds of phosphate binders. They can be pills, chewables, powders, or liquids. Some contain calcium as well, but not all. You should only take a phosphate binder if prescribed by your doctor or dietitian. So that's actually really important. We're going to bring that up with the next few slides. So thank you for listening about phosphorus. I think you got the tip, PHOS. So let's do a general review right now. Guidelines for stages 1 and 2 of chronic kidney disease. You will have less limits on what you can eat. And in the stages of kidney disease, it's important to take the steps to keep your kidneys from getting worse. The food you eat plays an important role in managing your kidney disease. And in many cases, healthier eating can stop your kidney disease from getting worse or slowing down your progression to kidney failure. Healthy eating can also help control diabetes and high blood pressure, the two leading causes of kidney disease, which can help keep kidney disease from getting worse. So we have some other suggestions to look at. Look for foods that say whole grains, choose lean proteins, drink enough fluids, and eat plenty of fruits and vegetables. We find that choosing non-starchy vegetables over starchy vegetables, so that would be like string beans over potatoes, is a good healthy swap. And the healthy carbs in non-starchy vegetables can also give you extra energy you need to get about your daily activities and keep your heart and kidneys healthy in stages 1 and 2. Remember, avoid your excess salt intake or sodium. Keep reading your labels. And that 2,300 milligrams is about a teaspoon of salt a day. And then interestingly, we didn't really focus on this, but definitely avoid foods that are really high in these ingredients. They're basically all different forms of sugars. Fructose syrup, glucose syrup, honey, maltodextrin. These are all different words for sugars. Isn't that interesting? Corn syrup. So we invite you to just work on cutting back on your sugar intake. And then watching your fat and cholesterol by using heart healthy oils such as olive, canola, avocado, or sunflower oil, and limit the saturated types of fats such as dairy, animal, or coconut oil. And then watch out for trans fats, which are like some oils or some baked goods that have fats that have been baked and they've been converted. That's a whole different topic, but anyhow, stick with more polyunsaturated and monounsaturated oils. Really important, if you're smoking, quit smoking, because this can raise your blood pressure and damage your kidney disease. And we have some info where you can find on that, smokefree.gov, and limit your alcohol intake because too much alcohol can damage the kidneys. The guidelines for stages 3, 4, and 5 are to remember that we really want to watch our protein intake because you are more prone to damaging your kidneys with diet, and so you want to be careful with what you choose. That in stage 3, 4, or 5, your kidneys are not working as well as they did in the earlier stages, so check and find out if you have a fluid restriction. And making changes to the way you eat, such as the sodium and protein and potassium, can influence the amount of fluids you consume, and it can help you prevent further damage to your kidneys and slow down your progression to kidney failure. So be sure that you're working on the quality of your protein. Get lean proteins. That means not high in fat. Lean proteins from whole eggs, quinoa, egg whites, fish, pork tenderloin, skinless chicken. See, the skin is full of fat. So skinless turkey, soy products, lean beef products, and watch your serving sizes of them. A half a cup of beans, 1 large egg, or 3 ounces of chicken, 3 ounces of fish. So just watch the protein. If you remember, they said about 7 ounces for men and 6 ounces for women. So keep your eye on that. If you watch your fluid intake, try to stick with water and don't consider sodas a source of fluid, right? Because they're full of phosphorus, especially the dark ones. So find out from your doctor if you have a fluid restriction, if you need to watch how much you drink. Find out from your doctor what your sodium restriction is, and just be careful to read your labels and pay attention there. Too much sodium can raise your blood pressure and it can make your kidneys work much harder. Find out if you have a potassium restriction, and if so, take a look at those high potassium foods again, and definitely work on focusing on the phosphorus in foods. Remember that PHOS is the ingredient word, and try to reduce the intake of that in your diet. Oh, this is fun. I know I've worked with so many wonderful clients and the Cecilia Health Kidney Program. They have great recipes. So you can go to National Kidney Foundation and they have recipes you can look for there. You can go to the Mayo Clinic and look for their kidney renal diet recipes, as well as the American Kidney Fund. So these are some links that you can follow to get some delicious recipes for good kidney health. And lastly, we're just going to briefly talk about supplements, and I'll tell you why in a few minutes. So, your healthcare provider may recommend some of these supplements. B complex vitamins are very important for good health. Iron supplements prescribed for good iron health. But what I would strongly recommend is only take what your doctor tells you to. Don't decide to go take an iron supplement unless you let them know that you're doing that, because if you have kidney disease, too much of some things may not be good for you. Your doctors know what they're doing, so ask for their advice. Vitamin C is very important because it helps with bruises and healing. Again, ask your doctor if they want you to take that. Vitamin D is very important for good bone health, and it can help during dialysis treatment should you have to go through that. Make sure your doctor knows what you're taking and what type you're taking. And last but not least, calcium is a very important supplement to take with vitamin D. However, if you are having severe bone issues or kidney issues, make sure that you are taking what's prescribed by your doctor. So under these circumstances, depending on your kidney health, taking supplements is like in the line of medication, and just check with your doctor. You can't beat that recommendation. So we've come to the end of this part of the presentation. Were there any questions? Well, I'm so honored to have been here tonight. We covered a lot of information. And I guess the thing that's most important for me is that you practice your label reading, you stick with your nutrition coach. If you have any questions that came up tonight, bring them to them in your next meeting. We are honored to work with you here at Cecilia Health. The biggest thing I would say is label reading, keep an eye on what you're consuming, watch your sodium intake, and please feel free to look at some of the great resources that we offered you tonight.
Wonderful. Thank you so much, Nancy, for going through all of those. As you all can tell, there is a lot to the CKD diet. So, like Nancy said, talking to your doctor, talking to your dietitian will be so important. We do have here in September, we have CKD and cardiovascular disease. And then in October, our webinar is the long-term maintenance and emotional barriers that come along with CKD as well. As always, you can check us out on Facebook. You can also, please do talk to your dietitian that you're working with if you have any other questions about Cecilia Health or just about diet or anything else that pertains to your health. But we just want to thank you again on behalf of Cecilia Health, Nancy and myself. Thank you all again for joining us and have a great evening. Take care.